Well, welcome everyone. This is going to be an exciting panel. I hope that you've enjoyed the panels from earlier today. This panel, though, is going to be talking about rare disease and your mental health, the patient and caregiver focus. And I think that in talking with that, a lot of things have impacted the rare disease community with COVID in ways that, we can discuss and talk about. But some of it with the rare disease community, there were a lot of that touch connection, that personal touch connection that just hasn't happened because we weren't able to travel, we weren't able to do things. And how did that impact our lives and, and finding resources and availability. So I'm going to start by just saying that, welcome to everyone. Thank you all for your willingness to sit on here. And I know that Michael and Emmett and David, they do have another engagement that's going to be here in a half hour and they're going to be dropping off. But I wanted to say thank you guys for coming into this and what you're doing with the men's support group as well. Stacy, I'm going to start with you. Now, I will say one thing about Stacy. Stacy has attended every single rare fair that we have ever had as a speaker. She is near and dear to Eden and mine's heart. Stacy, thank you for being here. And please introduce yourself and tell us a little bit about yourself.
Sure. Thank you so much, Jeff, for that warm welcome. My name is Dr. Stacy Fewer. I am a clinical health psychologist, which means that I am a therapist that works with adults living with chronic medical illness of all kinds, but I specialize in rare and genetic disorders. I am also a rare disease patient. I was diagnosed about 25 years ago with Gaucher disease type 1. So I live as a patient myself and I have lived that experience. Currently, I also serve on the board of the Gaucher Community Alliance on the Illinois Rare Advocacy Disease Commission in Illinois and as the Illinois State Ambassador for NORD. So I am entrenched gladly in the rare disease community. And I think that this topic of mental health and rare disease is so important. So I'm really glad to be here.
Yes. Well, thank you. Thank you again for being here. And Sonia, it's great to see you again. We had an opportunity to do some recording for some of our slots or for one of our other slots that we have. But please introduce yourself. Tell us about yourself and where you're at and what your rare disease is.
Okay, so my name is Sonia. I'm from the UK, not too far from Gatwick Airport. So I've got a rare disease called FCS. I've always known it to be hyperlipidemia type 1, and it has got different names for it, but it's basically my pancreas is missing an enzyme and I can't digest fat. So whatever fat that I eat, it goes straight to my blood rather than my body, which then causes pancreatitis. So that's what I've been living with pretty much all my life. So I was diagnosed at 4 years old. Didn't have much of an idea about what the illness was until about 15, 16 years old. And then from then I started getting a little bit more information online. Things became more available. And yeah, I'm married. I've got 2 children, which I was told when I was younger that I would probably never have. So that's a blessing. And yeah, so at the moment I'm actually talking about my illness online. I haven't ever been open about it, and even my friends and family have only found out about it last year. So yeah, I'm trying to kind of get support and support others too.
Well, fantastic. Well, I since Eden has started following you, you have a great influence on and how you make people feel the positive impact that you're having on the community. Emmett, let's jump to you, man. You're kind of right below me in the tile. Tell us about yourself, your rare disease, and where you're at.
So good morning, everybody from California on my side of the world. So my name is Emmett Henderson III. I have been living with not too much of a rare disease called systemic lupus, but yet rare in men. So I've been diagnosed with lupus 26 years ago and pretty much went through the fire and back with it. This had caused me to open up my own organization, which is a nonprofit called Male Lupus Warriors. I literally want to represent and use the word male in my name just to let people know that you are hearing advocacy from a man with lupus. So with my nonprofit, it pretty much opened me up to do as much as I can for the community, with everything that is going on with men with lupus, men with autoimmune diseases, mental health is such a big aspect that I really push. So I push to help men get through their illnesses and help them speak up on it as of opposed to bottling it up like us men do. So I am here in the rare community to spread as much information as I can and awareness on men with lupus and men's mental health. And I really thanks you guys for having me part of this panel.
Well, welcome, Emmett. I've only been able to participate in one of your men's support groups that you guys host, and it was a great experience. Michael, I think you're in Philadelphia. Tell us a little bit about yourself and your rare disease and what's going on.
Sure. Thanks for having me here. Yes, I'm in Philadelphia, and I have a number of chronic diseases and diagnoses. One of which is rare. It's called FSGS, so it's a kidney disease. There are some groups that are sort of focused on it, but not everybody sort of I should say progresses towards kidney failure, right? So FSGS is one of these diseases. It's called focal segmental glomerular sclerosis, and it's encompassed under sort of a number of higher level diseases. But some people do end up in kidney failure, or it can then have transplant. It can come back in kidney transplants, and it can stay dormant and then come back. And there is some underlying theories that it can be genetic based. So I've had that since I was a little kid, only a couple years old. I'm 40 now, so it's been essentially my entire life living with it. It's led to a number of kidney transplants over the years, and some of the other challenges that I have that are not rare disease conditions. There may be some underlying connections, but we're not really sure. It's actually interesting to try to understand if they are connected to each other or not. So I've been involved with different organizations in the United States here that study rare diseases. And one in particular out of Philadelphia is called NEFCure. And they focus on a number of rare kidney diseases. And then I founded an organization a number of years ago, about 8 years ago now, and still on the board of that organization called the American Living Organ Donor Fund. It is not specifically geared towards rare disease folks at all, but it helps living organ donors. And it was sort of in the memory of my mother, who was a donor to me and sort of my caregiver, care partner for most of my life, along with my father. So just happy to be here. And along with Emmett and David, who I guess you'll introduce in a minute, we run this men's mental health with rare diseases group, and that's open to patients, parents, right, care partners, children of someone with a rare disease, et cetera. And that all formed during the pandemic. Yeah. So thanks for having me.
Thanks, Michael. Hey, David, you're up, man. David Ross from the UK.
Thanks, Jeff. Hi, everyone. Yeah, I'm David from the UK. I have a rare disease called Cowden syndrome. And last year, more or less at the start of the pandemic, I connected with Mike and Emmett because I kind of felt that there was a need to set up a online support group on Zoom for male patients, caregivers with rare diseases. And yeah, we have that we started once a month now. It's gone to twice a month, where we get together, talk about what we're going through, support each other, and they're just kind of there for each other in their own way.
All right, fantastic. Well, thank you all for sharing a little bit about yourself and what's going on. So I want to address a question right off the bat, and I think it's great because we have Stacy, who is in her profession that sees patients, and then we have you all who are on the other side, who are the rare disease patient itself. But I know that when I was younger, there was a stigma that seemed to be attached to mental health issues. And, you know, we have a wide range of ages and cultures here. But Stacy, let's start with you. In your experiences with people coming in, how do you address that stigma? Because a lot of people feel ashamed, I think, that they have a mental health. They think, well, I should be able to handle it. But how do you approach that with patients?
Sure. So it's interesting because I tend to work within the medical system. Most of my patients come from physicians and the medical side of things. A lot of times patients end up in my care because their physician couldn't figure out what was wrong with them and told them it was in their head, right? As most of us probably were, being on the other side of that as well. And so because I kind of intimately understand what that feels like as a patient, but also as a clinician, I try to do my best to really identify that pretty early on in the very first time that I see them, to kind of let them know that I believe them first and foremost, and that even if they have a mental health issue stemming from a medical issue, anxiety, depression, panic, what have you, I recognize that that does not negate the medical issue exists, right? Those issues are likely stemming from, and this is based on research in the literature, those issues are likely stemming from the physical, not the other way around, which is kind of what they've been told and have been fighting. So I try to get that right up front in some way so that they feel, you know, like they are in a place where they can then open up about it.
Fantastic. So to the rest of the group there, and I don't care which one of you addresses this, have any of you had to face that where you have been told and going in that, you know, it's because of another underlying factor, it's all in your head, there's really nothing wrong with it, you're making this up? Have any of you ever had to deal with that? Emmett, go for it, man.
Absolutely. I mean, we have what are called invisible diseases, and people are quick to judge. And you know, not to be gender biased, but as men, we're looked up to be at the highest point, and we feel that inside. It's just that because of our illnesses and what we go through, sometimes it kind of it limits our being of what we can do. So therefore, we do not want to show that, because then we're looked at as being weak, or we're looked at as they're not up to par, up to the job. So a lot of times of going through everything that we've gone, when I had to go in through my symptoms, which if the symptoms, first of all, men, we don't go in because we feel pain. But when we do go in because we have pain and nothing seems to come up due to you cannot see it, or when I have joint pains, which is a high symptom of lupus, and there's no tears, no fractures, no breaks, they're telling me that it's probably nothing. It's probably something that you did and now you're just feeling it. Go home and put ice on it. I mean, that kind of just breaks you down right there, to where if I have these pains again, I'm not going in again. And unfortunately, I did that for almost a year.
Well, man, thank you. How about any of the other, you know, Michael, David, or Sonia? Did you have anybody tell you that from the field and say it's just in your head, and how you had to deal with it?
Can I
have it. Yeah, going after you, Sonia.
Go ahead, Sonia.
No, I was just gonna say, like, I've never been told, like, you know, that it's all in your head, but I feel like I have been dismissed in other ways, like, you know, you've had this all your life, you know what to do, kind of thing. And I've kind of felt like I haven't had enough care because I've had it previously so many times. It doesn't mean this time it doesn't matter. And in that sense, I think, because that, I mean, I guess that's another sort of form of, you know, dismissal, someone saying that it's all in your head, and someone kind of saying, well, you know, just deal with it because you've had it before, you know what you're doing. That's the only kind of thing I've had, to be honest.
David, what about you? You were gonna.
Yeah, I haven't had quite it's all in your head, but I've kind of I think due to lack of awareness for my rare disease, I think kind of like some people think that, particularly one or two family members thinking, oh, you know, you're okay, you're still going out to work, but I have a condition that means I'm still able to go to work, which is a good thing. But with my condition, people in our community, quite a few of them have autism. There've been mental delays. We suffer with our condition in various different ways, and kind of like, whilst they're not obvious, you need to be make people aware about how our disease impacts people, because they just kind of assume you don't have the condition you have, or you haven't suffered with it. Definitely, as well, I would say a generational thing with I remember someone who's got the same rare disease as me. He's older. He said about someone who was younger, or there's something wrong with him, when he possibly was autistic, as well as having the same rare disease as me. So yeah, there's still a stigma, I would say.
Do you find there's David, with that, do you find there's ways that you can help combat that? Is there an approach that you would recommend using because it's about education, it's about awareness, it's also about, and unfortunately in the rare disease community, a lot of times you have to be patient with some people, even if you don't want to be. But is there an approach that you see to help with that?
I think it depends on the individual. I think with some people it's a bit difficult to get the message across. Perhaps I'm setting up with family members, but with other people, I think a good talking point for me was like the clinical trial I was on for my condition a few years ago in Boston. And then that was a good opportunity for me to talk to people at work about why I'm doing it, what's it's about. And actually people are they're kind of interested to some extent about it. I think you've got to find the right way in with some people. So yeah, there is an approach, I think, but it depends on who you're talking to.
Do you all find? Yeah, go ahead, Michael.
So Jeff, so the rare disease that I have, and I, is a challenge because most often it affects children. It's one of these kidney diseases that can be a leading cause of kidney failure or kidney disease in children. It does certainly impact adults, right? And so I got this as a child, and there was a lot less known about it, right? So I think you've got a varying degree in folks that sort of live in my camp here, where it's often can be, parents, right, and siblings kind of impacted with these things of mental health challenges a lot, so more than maybe children, particularly if we're younger, right? So I certainly had challenges as a child, right? But I think you also have to think about sort of the times and what's perceived by children versus what is not perceived by children, right? And then young adults, right? Even folks into their early 20s and 30s, right? So I think we've got to, take a step back and look at the spectrum of where people are in their ages to really kind of understand how these mental health challenges can arise and who they're impacting, right?
Stacy, I had a question for you that kind of spawns from this. And you've been doing, obviously, for a while, you've had, your own rare diagnosis, but have you noticed a change in people's approach when they come in? A lot of times, I will say this, that I think over the last decade, I have seen a shift in the rare disease community, that we're becoming more vocal. Whereas before, our culture has changed quite a bit when, instead of hiding someone or hiding that, you embrace it and you let people know about it, because that's the best way for you to be treated like others, if you will, because that's something that Cambria goes through. She just wants to be like everybody else. But have you seen that shift over time? And if you have, what could you, not give medical advice because we're not doing that here, but what would you say to someone who's saying that, should I be more vocal? How do I be vocal about that? Can you speak to that at all?
Sure, absolutely. I have seen a shift, and I think that the increase in social media is a big part of that. It has allowed us to amplify our voices, but I can tell you that when I was diagnosed in 1997, I was 20 years old. And this was a few years really before social media started to take off the way it did. And so, I was traveling around the country and speaking at patient meetings and, medical conferences and pharmaceutical companies and things like that. And, felt like one of the only people doing that, as I'm sure I wasn't, but we just weren't as connected as we are now. And so now with all of the different social media platforms, I think people are realizing and have realized that we've all been doing this work for decades, but we just didn't know each other. And we just didn't know all the resources that were out there. And so I think I've seen, really big change in that. Now you go online and you do searches for rare disease, and there's 6 or 7 main umbrella organizations. And then there's your specific disease organizations. And it's almost overwhelming, I think, now for some patients that are new to the communities. So I spend a lot of time with my patients because I have that advocacy background, helping them locate, what are the resources that might be helpful for them educationally, financially, support-wise, what have you. And I'm sorry, the second part of your question, Jeff?
Well, and I think that's the part of it, is that how would you suggest to people, to become more vocal? Because, we could do that a number of ways. Social media is one way. But some people don't they don't want to be criticized or condemned for their rare disease. They don't want to put themselves out there, but they want to educate people at the same time. And I realize it's a fine balance, but how do they address that and still keep a positive mental state about themselves?
Yeah, I think, if somebody is not comfortable with being vocal or public necessarily, one thing that they might do is approach their physicians, their medical teams, and see if they're open to, a lunch with just their office where the patient could come in and speak. I used to do a lot of speaking in medical school classes, like for first-year medical students. I'm trying to get into some of those situations through their medical teams or their advocates or case managers through their treatment teams, things like that. I know some of the companies are helpful with that, or a local support group of other patients, for example. I think there's ways to do that without necessarily having such a public profile.
Fantastic, thank you. So I'm going to move because I want to ask this next question before you guys have to drop off with it, is that with your, and obviously with mental health being what it is, what's been your greatest challenge in looking at either mental health treatment or staying positive with your mental health portion of coping with your rare disease? Michael, we can start with you.
Yeah, sure. Thanks, Jeff. For me, it's a really interesting question because I have seen therapists on and off over the years, and I think one of the biggest challenges for me has been finding somebody that I can connect with, whether it was a social worker or somebody with a PhD, PsyD, MD, that sort of understood, I think, the challenges that we face as folks with rare diseases, right, versus somebody that may have lost somebody, or the challenges can be very different, right? And sort of if they've never maybe interacted with somebody who has that rare disease and doesn't understand it, I think that has caused some of the issues that I have had trying to get help over the years with certain things, and just that it was some of it was really just hard to describe. And oftentimes then somebody, a therapist or somebody, wanting to lump me in with something else, right? And I didn't feel that it was very applicable, which for me was really a challenge. And then talking about it publicly versus, in a community type setting has been very different, right? So, some of these therapies have sessions with groups, right? Like we do at the men's mental health group, but it's very different than being in sort of a larger group that where everybody's just having different types of challenges. So I think that's it's been a big challenge for me over the years with those types of things, being lumped in with other patients where I was like a young adult, but people were much younger. And I was experiencing very different things, right? When I was a young adult in college versus somebody who's 10 years old, right? So.
Yeah, absolutely. Emmett, how about you?
Well, I want to say that my challenges came in my early years in the 90s when I was diagnosed. Like Stacy said, you know, we didn't have too much of Google, so I couldn't look up what my disease was and I couldn't do anything much about it. But I was literally told on the day I got diagnosed that I had a woman's disease. So what did that do to a man that at that age has his own property, his own car, managing a company as one of the youngest employees, and to be told I have a woman's disease and there is no cure for it was something that was really hard. So one of the biggest challenges for me was acceptance. It was one of those that I just told the doctor at that point, just give me my pills so I can go home. And it doesn't work that way. And so with having systemic lupus, with almost every organ affected in me, few transplants, replacements, failures, I've been through it all. But one of the biggest challenges again was accepting that this disease was bigger than me because I am not a woman. And as I got older and started to learn about the disease, now that we have social media, then getting involved with people with lupus, and then listening to my same rheumatologist that was with me for 24 years until she retired, I've got to understand that now I can accept this, and now I'm even stronger now to get past any ailment that it brings me. So therefore is why when my last episode of having a brain disease in 2019 took me out of work all those years from working, I decided to advocate and put out there what was challenging me back in the day that I feel now that I can help others with challenges today.
Man, thank you for sharing. David, I know your situation's a little different and because you're in the UK, but what do you think on this topic?
Thanks for your comments, Mike and Jeff. Mike and Emmett, I think kind of getting support is from a counsellor therapist. It has helped me, but also I think being connected to other males in rare community through the group, talking in the group, or talking to other males with rare diseases on a one-to-one. That's kind of that's been a big help as well in terms of like other rare fathers with rare diseases, or just other issues connected to having a rare disease. I found I've needed support, and whilst counselling and therapy has worked for me, I've kind of having that support from other rare males has made the difference.
I just want to jump in here before the men leave us and say that for all of those reasons, I also sought counseling myself when I was younger, trying to find some help, and it was so lacking that I became a doctor myself. So it was so difficult to find a good fit and to find somebody that understood rare diseases and to somebody that understood really the journey, that I went and I did it myself. That's how difficult it was. So I think, all of you make really good points.
Yeah, and Sonia, you're in the UK, and one of our attendees here just made a comment, and I don't know if you've encountered it too, but it said in the UK, it's very difficult sometimes to get that professional counselors because they're not allowed to meet in certain social settings. But what have you encountered with that?
Well, to be honest, my challenges have been different. I've been through quite a lot of different challenges, and of all different reasons as well. First of all, I'm South Asian, and South Asians don't talk about, forget rare disease, any disease. You don't talk about not being well. You don't talk about mental health at all. These are all or any other sort of taboo topics. We don't talk about it, and it's always been the case. So for me, that was a challenge. Secondly, the fact that, again, when I was younger, I was diagnosed, didn't have much of an understanding. There was no internet, of course, like I couldn't research or anything like that. And like I mentioned yesterday as well, like every time I went to the doctors, they were just telling me like, okay, you just need to watch your diet. That's all your condition is. You need to eat low fat. And that's the only information I had, the fact that I had to eat low fat. And getting sick, even when I'm doing that, it was difficult because I didn't know what else what else I could do or who else I could talk to. we had different consultants that we were seeing, and they were all saying the same. They said, you know, your pancreas doesn't break down fats, so you need to stop eating fatty food, and that was it. So that was difficult then. And then as I got older, it got even more difficult because obviously, you know, getting married, wanting to like start a family. And when I was in my teens, they always used to kind of say to me, like, you know, when you're ready to start a family, we have to make sure it's properly planned. Chances are you probably won't be able to have kids because of the medication I'm on, and stuff like that. And obviously, as times go on, things changed. There's more treatment available. So fortunately for me, I was able to have children, but even that, it was a, you know, it was a massive challenge because it was basically hit and miss. Like either you're going to have healthy babies or you're not going to have them, kind of thing, up until like delivery day. So I was told on the day of delivery, like that, you know, the baby might be stillborn, and to get like, you know, people tell you stuff like that, it's just difficult, and you don't, you know, you're not mentally there anyway, and for them to kind of just bring that on you like as you're about to give birth, it's very hard. And I felt like I had nobody to talk to. This was during my first pregnancy, and again, like I had no knowledge because I wasn't supposed to be talking about this to anybody, because obviously the family are like, yeah, nobody needs to know that you're not well or you've got, you know, this condition, you know, we don't need to say anything to anyone, kind of thing. So because of that, I kept it to myself, and I literally only opened up about a year and a bit ago, when I had my second baby. And yeah, I think they're the main things that I've sort of had, which were really, really challenging, pretty much from when I was really young up until now.
Thank you, Sonia. I mean, your journey has been so different from other people's, and like when we talked and we visited the other day with it. Stacey, I have a question. It's kind of an odd one, a little bit different that I haven't heard talked about, but do you see a lot of people coming in and going, hey, because we are smartphone driven, because we have that, hey, I got this mental health app here, and you know, is it a good thing? Is it a bad thing? You know, for them to do it. Some people would say, well, if it helps with their positive mental mindset, then it's a good thing. But, you know, is it really? And can you speak to that at all?
Sure. Yeah, I definitely see that quite a bit. And, you know, in general, I would say, you know, I haven't really run across many situations where, you know, it's been a bad thing. I think, you know, it's more of, you know, from my perspective, incorporating it with the rest of our treatment. So I always just want to make sure whatever they're doing on their own is not counterproductive to what the work that we're doing together, right? So if they're, for example, using an app that's giving them, you know, instructions on pain management or anxiety management or things like that, and it's working against what we're doing, then I'm going to try to find a way to make it all work together. So, you know, there are certainly apps out there that are not helpful, you know, in many different areas, especially with, you know, I think young kids and, you know, things that they're being instructed to do that are maybe not so helpful. But in my population with adults, it's more just a matter of making sure that the treatment is working together and what they're doing at home is fitting their goals, right? Their goals is most important. So I personally haven't run into anything, you know, too scary or negative with that.
All right. Sonia, you're a social media influencer, so you're online all the time. With that, you know, we kind of talked a little bit about how you stay positive, and I really liked your answer that you did the other day. But do you use any kind of, you know, app to help you? I know that there's some, like even with Cambria, she was going through an extreme amount of pain, and we had an app that was a breathing app that would help her breathe in and out. It just more like it helped relax the body. It helped her to sometimes cope with. Sometimes it doesn't do anything at all with it. But what about in your experience? Because your rare disease, you can have a lot of pain with pancreatic attacks. What have you done?
To be honest, I have tried like mental health apps and stuff. I don't find them helpful, to be fair. I've also tried. I get people like ask me to try all sorts of things, especially you know, people like my mum, for example. She's constantly on YouTube looking at all these different like home remedies and like things to help me with my anxiety and stuff like that. So she's always sending me all these things, and I've looked at everything, and to be honest, for me, it just doesn't work. It doesn't work. And I feel like it's up to me, you know, like I don't need an app to help me. I just need myself to accept what I have and deal with it my way and try and help people because it's helping me. You know, I get a lot of people say to me, how come like you've got these issues and, you know, you struggle so much, and on top of that, you're a mom of two, you know, that must be driving you up the wall as well. Like, how do you stay so positive? But I have my own sort of ways that I stay positive. I am quite a bubbly person, so I tend to turn everything into a joke. I'm not saying mental health is a joke, it's not. But for myself, when I kind of like, I don't know if you've seen like my reels and stuff that I do on Instagram, I just turn everything into a joke, but there's a deep meaning behind it, because if you read my captions, it will show you what I actually mean by that. But I'm just showing it in a funny way, because, you know, I'm not the kind of person who'll just sit here kind of, you know, feeling sorry for myself or like, oh, why have I got this and why am I struggling so much? So for that reason, I just try and think of the positive in everything I go through. And that's my coping sort of mechanism. Like that's what I do, even though I've had so many hospital admissions, even when I'm in hospital on my own, knowing that I'm not with my children, you know, my husband's probably at home struggling with them. I still find a way to just think positive and just focus on getting better and just, you know, getting home. Another thing I've actually tried, like what you mentioned, like breathing, like the breathing techniques and stuff, there's a little device that I've actually got. Somebody sent it to me as a gift, and it's like it's got like a lavender scent, and you breathe into it, and it counts your sort of breaths that you take and stuff, and that's supposed to help. Like it's like a quick thing, like a 3-minute thing, when you feel like you're you know, about to have an anxiety attack or whatever it is, or you feel like you need to calm down. You can just get this little device and just use it. In all honesty, it helps, but it's a very, very temporary thing, because it helps for that minute while I'm breathing, and then when I stop, it's like, okay, like I need to get my head right again. So yeah, I don't know, I just feel like I have better control over my mind if I kind of just accept things and just, you know, do things that I feel that are right for me, if that makes sense.
Oh yeah, it absolutely does. And along the same lines is that, you know, doing the things that you love, that you like. You're obviously on social media a lot. You know, we are as well. What about so often, and you read about it, is that, you know, social media is a tool. It can be used to be positive, it can be used to be negative. With somebody that is out with a rare disease, though, how do you tell them to handle? There's a lot of negativity that can be derived from that, but the social media is almost, if you will, it's almost addictive. It's almost like a drug sometimes, it seems, with it. What's your experience, Sonia, with that, your own personal mental health, because you are a social media influencer, and a very positive one, which is why you're here. But what's been your experience with that? What can you tell people? How do you combat that?
To be honest, social media has helped me, and that's the reason I still carry on using it. You know, to try and find support, try and support people who need it. You know, if I felt like this isn't for me, if I was getting a lot of negativity from it, I wouldn't carry on, because I wouldn't do that to my own mental health, you know, to go through, you know, stuff that I don't need to be going through. But since I've been active, like religiously active online for about 2 years now. I started opening up about my condition, and mentally I feel better because I get people not only asking me how I deal with things and, you know, et cetera, but they also send me tips, stuff that I might be missing or I might not be doing. So for me, it's like a comfort thing, because I feel good that I'm, talking about my experiences and I could be helping somebody out there. Maybe I'm not, maybe I am, I don't know, you know, but I also get people who comfort me as well. So whenever I write about something that I'm going through, you know, I'll always put like a little positive thing at the bottom, like, even though I'm going through all of this, like, this is how I'm coping with it. And I still get hundreds of messages, and, you know, people will suggest other stuff and like just give me tips and ideas on how to combat some of those issues and things like that. So for me, it's always been a positive thing. And the minute I find it negative, I will stop. And I've said that so many times because, you know, like I said, I don't need that for my mental health. Like, if it's making me happy and if I'm helping people and people are helping me, I'm all for it. So I think it's a positive thing. And I will be continuing with it for as long as it, you know, as long as I can. But another thing is as well, with my condition, because it is so rare, so 1 in 1 million get this condition, or about 1 to 2 in a million. And I've never met another person like me with the same condition, never, up until last year. So when I started being open about my condition, I joined a group on Facebook and on Instagram, specifically for the condition that I have. I met these people, not a lot of people because it's such a rare disease, but I met a handful of people who have the same condition as me. And for me, that was really weird, like, oh my God, there's more of us out here kind of thing. And it was nice. It felt good. Like, you know, obviously it's not nice that they have this disease, but it's nice that we can exchange tips. And like my thing is more to do with diet. I have to really watch my diet, and it's been the biggest challenge from a young age up until now, and I still struggle with it. But to get help with stuff like that is what I need. And I find that's what I find so positive about having like a community online, where you can get that support. I've had support from family all my life, but it's not the same kind of support. You know, even though they're helping you and supporting you in the ways that they can, in my case, when I have to go to the hospital for like a week stay, my parents will look after my children for me for a week. That's the support I need, of course, but it's a different kind of support when you're talking to people who actually have the same condition as you. And that's what was lacking all these years. And now that I have that, it's almost like I wouldn't want to leave, that kind of thing. So that for me is a very positive, and it's helped me a lot mentally as well, knowing that I'm not the only person who's struggling with this kind of thing. So yeah, that's been really positive for me.
I think that's a very interesting twist, because so often we hear right now about, oh, social media is impacting our teens, impacting our kids, impacting our communities in very negative ways. And how do we, get them off of social media with that? But during this time of a pandemic, social media is sometimes the only outreach that you have, with it.
Mm-hmm.
Stacy, what do you see with, patients as general? Is social media, has it, because, like you said, back in 2000, there really wasn't a whole lot. And it wasn't until really 2007 that smartphones really began to take off. And then, in the decade that followed, there was this big surge, and now we're all over the place. But so you've definitely seen, a lot with it. But what do you see as being the impact with the mental health of individuals and social media? Do you see it as being positive, negative, or is it really about the water that you choose to drink?
Yes. First of all, I completely agree with Sonia. My experience, as a patient, has been that social media really helps with the isolation of having a rare disease. And Sonia, it sounds like you have an ultra rare disease.
Mm-hmm.
And that's been my experience as well, is that, that peer support is so, so important. And one of the wonderful things about social media is that it allows us to connect to that very small group of people that are living all over the world, that we otherwise would never have known. And even though we may never meet them in person, we know they're out there. And it really, really helps. The isolation of rare is one of the biggest psychosocial issues that we deal with. And so I really agree with that. I do think it's the water that we drink, Jeff. And, because there's so much out there, not everybody understands how to navigate that, to find the reputable sources, to also understand that these are peer groups that, don't take medical advice from your peers, right? Always, 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 check with your medical team, your physicians, about anything you read in these peer support groups. But mostly I agree. I feel like it's a positive influence. I strongly encourage most of my patients, to find as many peer support connections as they can, and social media is it. And with the onset of COVID, it hasn't only been helpful social media wise, to connect with peer support, but also it's been the only way rare disease patients have been able to connect with their physicians, their therapists, their medical care. I had an appointment with my doctor at Yale a couple of weeks ago, that I otherwise would not have been able to attend, because of just the internet and thankfully all of the video conferencing that has, telehealth that has come up with all of this. I think that's a really important part of this too, a little bit different than social media, but how important the internet has been for rare disease patients in general, now even with our care and my own patients' care with me.
Thank you, Stacy. I think it's really important right now that, because it is one of the outreaches that we have, and it is one of the things that we have to do, that people understand that they really got to be careful of what they see, what they read, and you can give example after example with that. One of the other things I wanted to ask, and this will be probably the last thing, and then kind of open this up for questions if people have any, is the support system that you have for the mental health aspect of it. So Sonia, I know you've had a great support system in your family, your husband, your parents. What can you say to someone about that support system, and saying, if their mental health is, is there a way that you see that they can encourage their family to be more supportive of them, or find ways to be for their family to engage in their, in their mental health?
See, I feel like family really needs to be a lot more involved. I mean, like you said, I've had the support, which, I'm really grateful for. Like, my parents have always been there for me, when it comes to hospital visits, hospital stays, cooking separate meals for me. They've done everything that they can. But I also know people through social media as well who have actually said to me that actually my siblings or my whoever, like, they don't understand it. It's all about education. I think they need to be more involved, take it a little bit more seriously as well. It's not just a condition that you have and you just got to live with it. Like, you need to be there for your loved ones. Before I got married, I obviously told my husband what I had and everything, because I needed to know that is he gonna support me and be there for me, and it's also for him as well to think, like, actually, do I want to get married to somebody who's probably going to be in hospital a lot, and when it comes to like children and stuff, actually may not be able to have children. All these things we need to consider. So it's all about education. So when we were together, I obviously educated him on what the condition is. He did his own research. But I think you need to push, like, if you're not getting that support, you need to push whoever it is, whether it's your parents or your partner, siblings or friends, whoever you live with, they need to be aware of what condition you have and how to support you. I'm not saying they need to like sort of look after you 24/7, no, but they need to know what condition you have and support you in that way. I think that's really important. Yeah.
I would also just add that one way that might help families, seek that support is through understanding that they, as caregivers, also need support. And so sometimes when it's hard for them to understand, the disease process or all of that, helping them seek their own support as caregivers and recognizing, learning that they are, an important part of this system now, and they need to also care for themselves, can be a doorway to helping them be more open and willing and able to learn about, the individual's disease and process and things that they're going through as well.
Of course.
Yeah, I would agree. And, we hear time and again, and we've actually heard it on a couple of panels here about how, the family, they don't get it and they just disappear. I mean, immediate family. And let's be honest, we've experienced it, ourselves. Our family does not reach out to us. They don't check. They don't see how things are going. And you have, these things that you pick up. But I don't know, sometimes I think it hurts worse when a family, if a stranger does that to me or an acquaintance does it to me, I'm like, they get it. But this was family, this was blood, this was, when I was raised, family was tight. And in having that aspect of it to be kind of missing can definitely impact people, in which case I, tell them, said, well, seek that out, find it. That's why I think, Sonia, like you were saying, the importance of it, you're 1 in a million, literally 1 in a million. But it was refreshing to find somebody in your group that you can go, they just don't get that my diet is so restrictive. And they're like, oh, we'll just have this, but they do get it. So I want to thank you all. I haven't seen any questions directly in the comments. I wanted to thank you both for being here and contributing to it. And I guess, Sonia, I'm going to have do this. We did this when we were talking about the other panel discussion or the other session discussion it is. But as we close out here, I'll have you go first. What is one thing that you can say, or what is one thing you can say to be positive to someone today about their mental health, or to say what would be your word of encouragement for them today?
Just to accept what you have. If you've been diagnosed with a condition, just accept it. Nothing is worse than not being able to accept it, because if you can't accept it, it will just play on your mind and it will ruin your mental health. Accept it, educate yourself on it. If you're not like me, I had to, because my disease is so rare. I had no idea. Even now, I still look, still educating myself. Learn about it, talk about it, don't bottle things up. I've done that as well, and it's not been nice. Try and get as many people to help and support in terms of family and friends, make them aware of what you've got, and just try and be as positive as you can, by doing the things that you enjoy and not letting your disease stop you from living your life.
Well, thank you for sharing that. Stacy, I want to put it to you, a similar question from more of the clinical side. What is something that you can say to this, maybe somebody they're having that in they're struggling right now. What would you say to them, in addressing this about how to become positive?
I would say that one of the, again, most important ways to start to dig into that mental health hole is by seeking out that peer support wherever you can find it, because it first and foremost addresses that isolation that can be such a big part of the mental health struggles, right? Feeling like nobody understands me. I'm the only one that's dealing with this. People are abandoning me, right? My family, doesn't understand. Even the people around me every day don't understand. So finding that peer support is so, so important. The other thing that I would say is that finding a way to process your emotions. What I explain to people a lot is that we have so many messages about our emotions that we're allowed or not allowed to feel sad or angry or down, or even happy. We've gotten message about you could be happy but not too happy, and our emotions are data, right? They're data. It's information that tells us how our environment is affecting us. So seeking therapy or group support or discussion groups or reading articles, anything that allows you to feel your feelings about this and get them out and not avoid them, is so important. We're often told that being sick is a failure of some kind, that that stigma, especially a genetic disease, right? That if something is running in your family, there's so many deep emotions that can come with these issues and these diagnoses. And so emotions are data. Feel your feelings, find a way to process your feelings, talking about it, journaling about it, writing about it. For me, being an advocate and a speaker was a way for me to process my feelings as well as educate and feel like I was doing something helpful. But it was my therapy for so long, right? Because I was out there and I was telling my story over and over and over again. I was getting it out of me. So find a way to process your feelings.
Well, thank you both. This has been fantastic. I appreciate the time that you've taken, the input that you've given. You're sharing your professional and your personal experiences, and the mental health aspect of the rare disease. So, we have Cambria turns 13 in next month, and we are beginning to see we talked about, we thought it was hard when she was little, but because she couldn't tell us what's going on. Now it's harder because she's got an attitude about things. So, we're beginning to see that teenage years and dealing with the rare disease and how is that impacting her mentally when she does. And it's a battle, and we try to do things to keep her positive and keep her going. And I really appreciate you all taking the time. Sonia, thank you for being a positive example in this community. And thank you for being having a level of humility. It's awesome to see from someone who's a positive influencer and the things that you say. And Stacy, thank you for the work that you do, and not just from being the professional in the field, but also on that other side of it, having been the patient, you can relate. Thank you both for it. Thanks to the guys. I know they're not on here. There's their with their mental health group that they're doing now, the men's support group that they're doing. So thank you all. It's been wonderful. I look forward to seeing you all in the future. We'll be in touch. Stay in touch, and take care. Thank you so much.
Thanks, Jeff.
Thank you.